All right, you guys have been standing by patiently hearing my mishaps on the air going on live for you, but we are doing a Facebook Live. I'm joined by Dr. Heidi Gullett, or Dr. Heidi Gullett, I'm sorry about that, medical doctor, Cuyahoga County Board of Health, the director of the Board of Health. And so you've been very busy of late for good reason, because a lot of questions about none other than the coronavirus. That being said, there's a lot that we know, but we have some frequently asked questions that we were hit with recently via email and Facebook, Twitter, all of the platforms. So we'll just jump right in.
Okay.
Trying to dispel some of the confusion. All right. So Renee wants to know, if you get the virus, how long does it last? And what do you do if your child gets it? Also, what do you do when working with the public? That's a lot to unpack right there, but
Sure.
Go ahead and tackle that for us.
Yeah, so those are really great questions. So the first thing I'll say is we don't entirely know exactly how long the virus will last in each person. It's pretty dependent on the specific person and what other illnesses they have or what other things may be going on with them. But what we do know is there are certain things that the CDC tells us, and it's a case-by-case basis about when someone would be cleared to go back to work or to go out into public and wouldn't be infectious anymore. So those kind of things would be free of fever for more than 24 hours without taking medicine, and not having a cough where you're spitting, respiratory droplets in the air, which we think is how this spreads.
I just read something earlier today talking about the fact that, well, this kind of alludes to the coronavirus. But not necessarily speaking specifically about the coronavirus. Many people out there, they go to work and they're sick, right? They have some symptom of a cold or something along those lines, and that does not do any of us any favors, right?
Absolutely. So this time of year is really a time where a lot of people have different kinds of illnesses. Influenza is still very significantly an issue in this community and many others. And so one of the things that we feel very strongly about in public health and also in healthcare is that please do not go to work if you're sick, and also don't go to school and don't send your kids to school if you're sick, because the chance of you giving what you have to other people is really high, and then it just sort of spirals.
How can people really delineate the difference between this and a common cold? Because we're talking about, coughing, sneezing, runny nose, things along those lines. Some of that may mirror the common cold, would it not?
Sure. So we do know the vast majority of the coronavirus, COVID-19 is the specific type of coronavirus we're talking about with this particular issue. There are multiple other kind of coronaviruses that do circulate. So I want to be clear about that. That name, COVID-19, is what the World Health Organization has given the name for this particular virus. But the thing is that the most common of them are pretty mild. Fever, shortness of breath, and cough are the three most common symptoms, and you are right. Those are the same symptoms we have with all kinds of other things, like influenza. But what we have to keep in mind is that the risk of COVID-19 to the average American and the average Clevelander is actually quite low. We don't have any cases in the state of Ohio. So in general, when people are getting those symptoms here and now, we suspect they're probably another virus, and then we test for those or treat those.
That being said, there's a lot of questions out there right now about the face masks. Who should wear them? Who should not? Is this the proper mask to have?
Right.
How does one know?
So we do not recommend that healthy, average Americans go out and buy face masks and wear them around. Face masks really are for people who are ill. People who have COVID-19, it would make sense for them to wear those and to stay isolated at home, or if they're sick enough in the hospital, they would be isolated without other patients in the same room. And the really important thing is that healthcare providers need to have masks and protective equipment so that our workforce can stay healthy and continue to care for people in hospitals and clinics. And so if people go out who don't need them and buy them, then it's hard for our healthcare workers to have what they need. And it's influenza season, so they need them right now. So the message is that the average person does not need to be wearing masks at this point.
That's a good point, because you're talking about a shortage, right? And we've seen that already with sanitizers, hand sanitizers, and things of that nature. And we can't stress this enough. We talk about washing our hands.
Yes.
You said that ad nauseum to people, I imagine, already.
Absolutely. So If anybody hears anything that I say today, it is that good hand washing is the key to prevention. So we've known that for a long time, but many people do not wash their hands with soap and water for 20 seconds every time they wash their hands. It's actually kind of a long time. That's not how long we usually do it. So that is the best way to protect yourself from COVID-19 and other viruses, is to do good hand washing and not to touch your face with unwashed hands, your nose, things like that. We know that these respiratory droplets can transmit viruses that way. So washing your hands is really important. The hand sanitizer seems to be all the rage. People are trying to get it, and I know many stores. I was at Target the other night for another reason, and I heard the person tell 3 or 4 people within 30 seconds, we're all out. But the reality is washing with soap and water is still best. So use hand sanitizer that has at least 60% alcohol in it if you don't have soap and water. But we really want people doing awesome hand washing with soap and water.
Awesome hand washing. And just looking at you and talking about this with our friends online, some of these questions are starting to roll in. Someone asked, can this live on products? And if so, for how long? I'm assuming they're talking about if they were to touch something at a local store or something along those lines, could somebody else touch that and later come down with this?
It's a great question. And actually, this is the same advice we would give for any other flu season when we didn't have COVID-19 potentially in the mix. So it is that, yes, viruses can sit on surfaces. They can sit on objects for a short period of time. We know with COVID-19, it does not seem to last for long periods of time, but we can't give you an exact amount of time. It probably depends on air temperature and things like that. I do want to reassure people that we have no indication that packages shipped from China, anything that's been shipped from other areas of the United States where there may be cases that's traveled for a few days in ambient air, has any ability to transmit the virus. So I want to be clear about that. The CDC has been very clear about that as well.
Good point, because a lot of times when folks don't know, imaginations run wild and kind of fill in the blanks, and not all of that is true.
That's actually the question I got from my 11-year-old. She said, well, could this come in a package? I thought that's a great question.
Right. And someone just asked, Jackie Moore asked if Tamiflu could help with this.
Great question. So influenza is one type of virus. Coronavirus is also a different type of virus. And there are about 7 types of coronavirus that infect humans. COVID-19 is simply one of them, and it's the newest one that we know about. They are very different viruses than influenza. So Tamiflu specifically treats influenza, but does not treat coronavirus. And we actually don't have any specific medicines right now to treat coronavirus. We treat symptomatically, meaning we treat for whatever symptoms you're experiencing should you have COVID-19. So it would be fever, cough, shortness of breath, supportive treatment.
And Dr. Gullett, this is a big question right here, because a lot of people are asking this in terms of trying to spend some time via spring break with the kids.
Right.
This person's asking if it's okay to go on a cruise and with their children, ages 4 and 6.
It's a great question, and I think I've gotten a lot of travel questions from many different folks, and I think it's important to think about where you're traveling and to think about what your situation is. We know that any of these viruses, including influenza, which is the biggest risk to all of us at the very present moment here in Cleveland, is that people with lung conditions and who are what we call immunocompromised, meaning their immune systems are low, they're at higher risks for viruses and infections this time of year than the average person who doesn't have any other health problems. So it's always important to consider, where am I traveling? And then, what are my underlying risks for contracting any sort of virus? We don't have any known cases here in Ohio, so you would want to think, well, am I traveling to a place where there are known cases? And what kind of activity am I going to be doing? It's got to be a personal decision, and you've got to kind of weigh things. The other thing I wanted to point out is there are a number of employers in our area who have restricted travel for their employees in recent days. And some of those are because they're healthcare workers, and others are because they want to make sure that they're not sending people into a county that's declared a state of emergency around this, like Los Angeles County or King County in Seattle. So you also have to think about that, and is there a restriction that you have from an employer or something like that? But it's really a personal decision based on the best available information. And as we talked about before, this is changing quickly, right? It changes from day to day. We know different amounts of cases and locations. So it's keeping up to date. And I would check the CDC website because they are very up to date as far as reporting the cases.
Checking that daily. And how does someone in your profession make sure that you're digging deeply into this while doing it safely? Because you encounter a lot of different things, and sometimes people may not know exactly what that is when they walk into the office to ask some questions. So what are some of the health restrictions you and folks close to you have employed?
Well, I think we use the same infection precautions that we use all the time. So it's really the things we talked about earlier about hand washing. And when we know somebody is sick,
Right.
somebody has influenza, I'm caring for them in the hospital, I'm going to wear a mask and I'm going to encourage everybody else entering that room and have the sign on the door and that sort of thing. But we also don't want to spread fear, and we also don't want to have any issues around stigma. We don't want to assume certain groups of people are infected because they may have an origin from a certain place. I'm very passionate about people having the right facts and understanding facts and not things that are driving fear unnecessarily. So what we do is we protect ourselves when it's appropriate, but we still provide the same care, and we know there aren't any cases, so we don't need to be overly cautious right now about doing things like wearing a mask all the time.
Right. Fear is contagious, isn't it?
Yes.
Tell me this, you have a lot of people out there who are trying to take as many measures as they can possibly take, but you can't really overemphasize the fact that you don't want to go to work if you're feeling symptomatic, and we also talked a lot about this here, the 14-day quarantine, because we spoke with some people who were out of the country making their way back, specifically some Kent State students. And they said they have to be locked away for 14 days. That's the time period we know, right? But you did say earlier, we don't really know how long this could last.
Right, and earlier I was speaking about how long it lasts on surfaces. So how long does it last if it's on a particular table or something like that? What we do know is this is most often spread person to person within a 6-foot distance. That we're closer than that right now, but I do not have COVID-19.
Right.
But it is spread through respiratory droplets. So if you're closer than 6 feet, there's a chance if you cough or sneeze without sneezing into a tissue or the bend of your elbow that you could be transmitting it to that person who's breathing in the air. But the reason that certain groups of people traveling from certain locations are asked to be isolated at home for 14 days is because our best understanding of this type of coronavirus is based on other types of coronaviruses we've seen, like MERS and SARS.
Right.
And we know that those tend to be 2 to 14 days to emerge after exposure. And so that is what we're using to tell people 14 days is the long end of when we might think that you would exhibit symptoms if you were infected. And those folks are being followed by local public health authorities, so they're not just locked away at home, but they actually have regular daily and sometimes twice daily contact with local public health officials to make sure that they're safe and that nothing's developing.
Something we don't really think about as we greet each other, and I made the same mistake. I said hello and reached my hand out there to greet you with a handshake. We don't even think about it. It's second nature. It's kind of ingrained in us. But this has really shifted the way folks approach things. We got a comment here on Facebook Live just a moment ago from Lolita. And I was going to ask you about this, but she beat me to the punch. The shot is for a different strain, meaning you won't get that strain, but you can get others. But again, we don't have a vaccine for this, right? Right,
we don't. So that's a really great question. And earlier I tried to differentiate between treatments for the flu and are there treatments for coronavirus. But at this point, we have a vaccine for influenza. It's seasonal, so we try to predict which seasonal strains of influenza will circulate, and that's what's included. And I strongly recommend folks get the flu shot every year. That's a really great way to protect yourself. But for COVID-19, we don't yet have a vaccine for that. And you heard federal officials talk about development of that vaccine, but the recommendation is that, or the average is about 12 to 18 months from what our federal authorities are saying around developing that vaccine. So this is kind of analogous to H1N1. If you remember back in 2009, we did get a vaccine for that a little bit later, and people got vaccinated for that in addition to the seasonal influenza vaccine. So once this vaccine's available, we will know, but we don't have a timeline specific about that yet.
Okay, we're running short on some of these questions, so please hit us up, guys. We definitely want to address your concerns. Anything out there that perhaps we did not talk about in the midst of this conversation that you'd like to address?
So a number of people have asked me about cleaning supplies and what covers treatment or what covers getting rid of coronavirus. Actually, if people have been looking at their cleaning supplies, you will see coronavirus listed on cleaning supplies because we have other coronaviruses that circulate. But so on our website, ccbh.net, we try to put the best, most up-to-date information. And so we have a list of cleaning products that are effective for coronavirus. A lot of people are asking about bleach and things like that. If you end up using hand sanitizer, again, soap and water, always best. But if you end up using that, you want something with at least 60% alcohol-based. And you want to completely cover both hands and let it dry. Then you know it's actually giving you that clean hand. So those are some pearls and things that I've been asked a lot about lately that I wanted to make sure we talked about.
You addressed a compromised system earlier in our conversation. So Alfredo wants to know if one had the flu before, where'd that question go? Oh, okay. So would having the flu first make it more possible to come down with this particular coronavirus?
That's a great question. You know, anytime you have one infection, it always makes you more susceptible or more at risk to another infection. So we know sometimes people get influenza and then they may get a bacterial pneumonia and an infection of the lungs after the fact. So certainly if you're not completely recovered from one infection, you can get another infection, and that would be the same for this case too. But in general, you would be followed by your primary care provider if you're sick enough to be in the hospital folks, and they would try to isolate you from having exposures to other viruses while you're sick with influenza. So hopefully your immune system would improve enough before you're back out in the world and able to get some other type of virus.
Another friend on here says, what about pets? Are pets susceptible to this?
That's a great question. So we do know, a lot of people have probably heard, several other coronaviruses, MERS and SARS, that I mentioned, the other coronaviruses I mentioned earlier, MERS and SARS, had originated in bats. And you've probably heard in China that there's some thought about this coming from animals. But what we do know is domestic animals here, there has been no reported infections of COVID-19 in domestic animals here. So the one thing we always try to say is if you're sick, try not to be really in close contact with your animals just as you wouldn't with your family members and friends, because they can get the infections we have, like, you know, other things that are circulating.
Yes, they can.
But we don't have any clear indication that COVID-19 can infect our animals and then that they would transmit it in any way. And the CDC actually has a nice piece on their website about that very question.
That's the perfect segue, because Daniela says, my mom is in San Diego. Do you think she should not fly home until this calms down? She lives in Ohio, but I think she's saying she has some health issues. That's something else that we've been talking about incessantly on our newscasts in terms of the elderly and very young folks, our children, not being exposed to a lot of different things because they're going to have a harder time fighting this off.
And that's one of the reasons the influenza vaccine is so important, because we know folks who are higher risk for complications, like young kids and even infants 6 months and older can get the vaccine, but also, you know, older folks with other diseases. Because we don't have a vaccine for this, we have to again go back to the individual situation. And I encourage folks to always talk to their primary care provider who knows their health best, and have an honest conversation about what your risks are for flying. Do you have a respiratory issue that makes it challenging for you to fly anyway? But in general, we are doing our best to both contain this and keep it from spreading, and also to be ready if there is other community spread. So I think the question for her would be, you know, talk with her primary care providers, see what they say about this. There's nothing that says you can't get on a plane to fly home at this point, unless the health officials in San Diego thought she might have been exposed, which that doesn't sound like the case.
And we can't overemphasize this. I mean, we have to understand some folks are tuning in now a little later than when we first started that, and that's just fine. We want you to join the conversation. Hit us up with questions, but you did address this earlier, but we'll reiterate it. Mary Ziegler Goodwill says, any coronavirus cases here in Ohio? The answer?
0. So we do not have any coronavirus cases. Now, the public health departments, both the state of Ohio as well as our local health departments, like Cuyahoga County Board of Health and Cleveland Department of Public Health here in the greater Cleveland area, we are very much wanting to make sure everyone has all the information. So if you go to the Ohio Department of Health website, you will see that there are what are called 3 PUIs, or persons under investigation. What that means is that we have 3 people who have had coronavirus COVID-19 tests sent off to the Centers for Disease Control for testing. That does not mean that they have COVID-19. It means that maybe they have a lung infection that was very severe and there wasn't another explanation, so that was sent out of an abundance of caution. But that does not mean there are going to be 3 cases here. It just means that there are 3 people that were tested. So the Ohio Department of Health is really trying to give all the information we can to the public, and 0 cases is the most important thing, but if folks see that, I wanted them to understand what that means.
Dr. Gullett, you're here to help, and we love you for it, but tell us personally how this has impacted your daily load in terms of people asking you what can they do? What should they be hypervigilant about? What has this been like for you over the past couple weeks?
Yeah, so I'm a family physician and I have a clinical practice in the community, but I'm also a public health physician at the Board of Health. And so I see both sides of it. So the way it's impacted me in my clinical practice is that people ask me about this regardless of the reason that they're there. They're there for a pap test. They still maybe want to talk about COVID-19 and how they can prepare themselves. And that's fine because I want them to get the best, most accurate information. But again, I'm giving people that same narrative around hand washing and around protecting yourself anyway. And the one bright spot about all of this could be that it elevates people's understanding about how to protect themselves from infections.
I didn't want to ask that because I wasn't certain if it, this has to obviously, washing your hands more frequently, keep you free and clear of other common colds.
But at least reduce your risk, right? At least reduce your risk of getting it if you're washing your hands a lot and paying attention to your surroundings and that sort of thing.
And the CDC, of course, constantly updating its website.
Absolutely. So that's a great source of trusted information as well.
Right.
So locally,
Right there in
our
your hands.
ccbh.net is a great place for public health information, but nationally, cdc.gov is as well. They do update several times per day, and so there's a lot of nice information for folks and a lot of great frequently asked questions, some of which we addressed today.
Yeah, I think this has been like medicine for everyone. Is there anything that I have not asked or our friends have not inquired about on Facebook Live that you would like to address?
I think I would just like to say that we have a lot of public health professionals in our community and also in our state that are really committed to keeping people healthy, not just when there's a risk for an infection like COVID-19, but every day of every year.
You're like, oh, they want to call Dr. Gullet now, huh?
No, but I just really want people to know that it's not,
Absolutely.
that we're here for you 24/7, 365 days a year. And when these things are heightened and there's fear, we get a little bit more media coverage and things like that. But we're a place where you can come for trusted information about all sorts of health issues all the time. And we want you not to live in fear of this, but to be prepared and to know where to go to find the information you need.
Absolutely. Phenomenal job. Thank you so much.
Thank you for having me.
Oh, no, anytime. Come on back anytime. And before we run, I want to let folks know, in an effort to stop the spread of the infection, guess what today? President Trump signed a more than $8 billion spending package. So, of course, this is a fluid situation, so more information we know will be on the way.
Absolutely.
I'll give you an elbow.
Yep, there we go.
Have a good one.
Thank you.